I want to talk about my new essay. It's out now in Tablet Magazine. It's entitled How the CDC Abandoned Science. I'm going to put a link down below. I recommend you read this. This is a chronicle of several examples of the CDC putting forth scientific studies, quote-unquote scientific studies, in their own publication, MMWR, that had grievous flaws in it, that they were just really fundamentally flawed. And these studies that they promulgated all supported policy conclusions that happened to coincide with the timing of the study. It's often as if it was preordained. I have a problem with this. My problem is that these studies don't really advance the scientific dialogue, and as such lead to mistrust and distrust of scientists. When the people who are running agencies like the CDC engage in this kind of science as propaganda, is it any wonder that people turn to other sources of information, that people go looking for who they find credible and plausible if the CDC does this for credibility? So let's run through the examples and then let's talk about that theme. Number one, the Kansas mask mandate study. Famous study CDC put forth, and they basically said that in July 2020, there were counties in Kansas that had a mask mandate and those that didn't have a mask mandate, and places that dropped that mask mandate had a reduction in caseload, and places that didn't had an escalation in cases. Well, crystal clear right there. Obviously, the CDC wanted to, in that moment, push for cloth mask mandates. Now, the way I would have done it as a scientist is I would have run a cluster randomized control trial. I would have run in the United States, and I would have asked whether or not the routine application of the policy of cluster of mask mandates results in less community spread in the areas that have it versus the areas that don't. That's the only way, I think, to get at the question. What did they do? They looked to see what happened. But of course, the counties that deployed the mask mandates were different counties than those that didn't. They were already on the upswing. They were getting a little bit nervous, and they deployed it. And then, even if they hadn't deployed it, they might be destined to have a downswing, because people are already changing their behavior in myriad ways to avoid getting coronavirus. The data scientist Yu Yang Gu, who's a graduate of MIT, he quickly noticed that this is a fundamentally flawed comparison, but he did one thing that was very clever. A few weeks later, he went back and he looked at the same study, the same time, the same counties, but he zoomed out. He took a longer historical look. And I'm going to put this picture on the screen. When you see what he looked at, he basically recapitulates the CDC's results, which were true for a very short period of time. But when you zoom out, you see that counties with the mask mandate and those without, they very quickly had a huge fall surge in cases, and they're almost indistinguishable. You can't really tell which is which. What does that mean? That means that the impact of the mandate couldn't have been all that much. It also means that the CDC has cherry-picked a very tiny time slice where it was fitting their story, but that wasn't true for most of the time interval. So that really is a fundamentally flawed study. The next example I give is the famous example of Pima-Maricopa counties that was, I think, beautifully covered by David Zweig in The Atlantic. And this was really the study that the CDC often offered in support of school mask mandates that really compared schools in Pima and Maricopa counties that had a mask policy versus those that didn't, to show fewer quote-unquote outbreaks, where an outbreak was defined as 2 or more cases. It wasn't necessarily fewer or more cases, which would have been more intuitive, as fewer outbreaks, which is 2 or more cases. Why they didn't just look at simple case numbers, I don't know. But one of the things they didn't do is they didn't adjust for the vaccination status among the staff. The other thing they didn't take into account was that these are incredibly politically fraught counties. There are places that are heavily Republican and places that are heavily Democrat, even amongst these counties. And it's very likely that political preferences do segregate with SARS-CoV-2 behaviors. And one side, the Democrat side, is more likely to engage in protective behaviors than the Republican side. And they're also more likely to have mask mandates than the Republican side. But it might be those other behavioral differences and not the mask mandate per se that's resulting in the different case counts. The other thing David Zweig notes is that some schools were open for more days than other schools. The more days you're open, the more opportunity you have to have an outbreak on one such day. So you need to standardize the amount of time, exposure time, in these two places. They didn't do that. And then the final thing he noticed was that the numbers didn't add up. There were more schools in the data set than schools he could find. And he kept digging and digging and digging, and what he ultimately found was that at least some schools were included that were actually remote schools, which don't make a lot of sense. To include a school that's not an in-person school would be, I guess, against the fundamental rules of the study, against rules of common sense. Put it all together, it's a deeply flawed study. It doesn't really prove what it claims to. Those aren't the only areas. The other example is the risk of diabetes in kids who have recovered from a SARS-CoV-2 infection. This was something that I've talked about, I think, on this channel before, on my Substack. It was a study the CDC was promulgating. It had very low absolute risks, but it made a huge error, which was it didn't even adjust for BMI. That kids who may be overweight, have medical problems, might be slightly more likely to get SARS-CoV-2. They may also be more likely to develop diabetes because they're slightly overweight. And you should at least compare them to people who didn't get COVID, who are of the same sorts of characteristics to isolate the effect of COVID, if you're going to claim that COVID, quote unquote, causes diabetes. Now, this occurred at a time when the CDC had a policy goal. The policy goal is to get 5 to 11-year-olds vaccinated. We've seen in population data that has stagnated at about 20%. There's 20% of people who are very keen on getting their kids vaccinated for SARS-CoV-2. And there's a lot of people who have, I think, reasonable reluctance. People are reluctant to try new things, especially in their children. Sure, that's to be expected. This study comes along to kind of raise the fear, the anxiety, the concern that your kid might get diabetes. That's why you ought to do this. In fact, that's what they say so in the discussion. That's a problem to me. They haven't really proven that. And then finally, I cite a more recent preprint that's out now from the UK, where they actually do know how to adjust for things appropriately, that actually finds that a child who gets a COVID diagnosis does not have an increase in diabetes and subsequent diabetes. I'm quoted as saying this, and this is what I say in the article: some might view it as a mistake, but I view it as the entire point of the study. Alarm might boost flagging vaccine uptake in kids. That's the problem to me, that you need an agency to be putting out impartial science, but if you suspect they're putting out science to get you to do what they want you to do, that science may or may not be robust and reliable. The last example I think I delved into was immediately after we had the launch of a vaccine for the 12 to 15-year-olds in this country. Immediately we went from, people talking about how hospitalizations are on the rise in 12 to 15-year-olds. That statistic ignored the fact that if you zoomed out, again, hospitalizations were still absolutely rather low in that age group. They are much less likely to be hospitalized in older groups. And it was still less than the prior December peak. That was also lost in the narrative. Again, it supports their policy conclusion. Finally, I think the way they've handled natural immunity, they have cited studies suggesting that among people who have been infected, vaccination further lowers the risk of bad outcomes. But then later, they themselves published, I think, a much better study, the New York and California experience, that shows that if you've had a natural infection, your rate of subsequent hospitalization from getting reinfected with COVID is pretty much bottomed out. It's as low as it goes. It's hard to take a really, really low rate and drive it lower. So finally, I meditate on the CDC. Is this an impartial agency? Is it? The head of the CDC is a political appointee. They're appointed by the president. The president has a different motivation than, I think, the public health of the nation. I think we have to be honest. The president, like all politicians, nothing against this president, it's just the truth of politicians. Politicians' number one goal is the perpetuation of their political strength, their force, is to keep themselves there, make themselves strong, make their party strong. Parties exist to strengthen themselves. In fact, they exist largely for that purpose. Their platforms don't even always make sense. They have internal inconsistencies. They have created platforms just to kind of divide the country into 50-50 so that they have an opportunity to, at least at some point, hold political power. And the platform is sort of a piecemeal arrangement that does that. But, it wouldn't make sense that a party, say the left party, that claims to champion the rights of children has picked a point of view of in favor, I think, more of school closure than the other side. That doesn't make sense from any sort of philosophical or principled point of view, and that's why I objected to that deeply. They are meant to perpetuate themselves. What does that mean? That means the person in charge, if it is a politician making public health decisions, will always do the things that improve their political fortunes. So driving down, quote-unquote, cases in the short term might be hugely important to a politician. Some politicians might say, let's just not even test people. We've all heard that. Other politicians might say, let's make sure everyone gets a booster. Even if boosting only has a transient reduction in short-term SARS-CoV-2 acquisition in young people, they'll still push hard on that because that's still a reduction in cases. And cases might be what they believe is tied to the economy, to all the things that they need to go well for their political fortunes to succeed. You cannot have a politician, I think, in charge of making fundamentally utilitarian public health calculations. You need somebody who actually, in their heart, wants to do what's best for people. Doing what's best for people, both in the aggregate, but also individually. And doing what's proportionate, doing more for those who need more and less for those who need less. If the person appointed by the CDC is a political appointee, if they're constantly feeling the breath of the White House on their neck, can they do such a thing? I truly think they can't. And what do we have now? We have an agency that has, on a number of occasions, pushed bad science. I mean, science that I just don't believe is convincing as somebody who spends a lot of time reading science and thinking about it. And they do so conveniently to support the political interest. And as long as that's the case, they are shredding credibility. I mean, I truly worry how much credibility they've already shred by some of their policies. The United States is such a chaotic place. We have, compared to our peer nations, European nations, much lower rates of at least one dose vaccination in people over the age of 65, lower rates of boosting elderly, lower rates of boosting nursing homes compared to the United Kingdom. That's a huge vulnerability. At the same time, we are so aggressively pursuing mass vaccination in the youth, even using the brute force of mandates and being thrown out of school and losing your job. That's also something the United Kingdom has not done. Our policy doesn't make a lot of sense if you're thinking about the well-being of everybody across a population. The United Kingdom makes more sense, and you can listen to the interview with Professor Ladani that we talked about yesterday. So I conclude with this paragraph in this essay, and I'll read it to you. I think it's important. Ultimately, science is not a political sport. It is a method to ascertain the truth in a chaotic, uncertain universe. Science itself is transcendent and will outlast our current challenges, no matter what we choose to believe. But the more it becomes subordinate to politics, the more it becomes a slogan rather than a method for discovery and understanding, the more impoverished we become. The next decade will be critical as we increasingly face an existential question. Is science autonomous and sacred, or is it a branch of politics? I hope we choose wisely, but I fear the die has been cast. In my mind, the worst case scenario is that there are two different groups of scientists that are subordinate to political parties. They're part of political parties. I worry that we're on that path. I mean, that path, that's where the car is headed. It's headed that way because the people who are putting forth studies are putting forth bad studies, very, very bad studies. I think on this channel next I might discuss that Nature Medicine paper talking about cardiovascular complications post-COVID using a Veterans Affairs data set. It's riddled with problems. It's trying to tell you that all these complications are due to having had COVID. It does not do that. It does not prove that to be true. It would be convenient to a lot of policy ideas that would be true, but it's important to know, is it actually true or not? We have the same thing, I think, around myocarditis. We have the same thing around a number of issues. We had that masking study that I've talked about on this channel. We need to be very careful that you cannot do science differently because you want people to do something. You got to separate the two. Science has to be about getting at the truth, and what you want someone to do is always a compromise of the best available science, the uncertainty, our values and preferences. It's always some mix of that. It's not so clear. There are things we can do in terms of science to try to minimize the uncertainty, but we have to acknowledge that a lot of it is preference and a lot of it is sort of judgment. What we absolutely cannot do is distort the facts in order to support the conclusions we want people to do. That is absolutely untenable. The resultant loss of trust will be cataclysmically bad. So those are my thoughts. This is the essay. It's in Tablet Magazine, How the CDC Abandoned Science. It's popular, good, it should be, and it's important. And I think we stand at a precipice, and we have to choose what to do. And I am concerned as somebody who I think cares deeply about science and has done a fair bit of science over the last 15 years. So if you like this video, you know what to do. Like, subscribe, comment, leave a message below. Ring that bell. Supposedly that means something. Until next time.